the medical problems that exist in life, a disease known as lymphedema is one of the least understood and most often misdiagnosed. The symptoms one generally notices are hugely swollen limbs, like arms and legs. It can be very painful and extremely debilitating. Interestingly, treatment for lymphedema is something not generally taught in medical schools. It's necessary to attend a continuing education course, such as that taught at the Norton School for Lymphatic Therapy in Matawan, New Jersey. To learn about the disease and the treatment, we've come to talk to Steve Norton, who is the founder-director of the Norton School.
So the Norton School of Lymphatic Therapy is a specialized continuing education school for physical and occupational therapists to learn the techniques of complete decongestive therapy, which is lymphedema therapy. What we do essentially is create specialists in the treatment of lymphedema. The treatment of lymphedema is not something that people learn in PT or OT school. It may be talked about for an hour or two, but there's never an extensive amount of information that's shared. And so what we do is take these people and invest a good 135 hours of education in them and create a certified lymphedema therapist, someone who's really specialized in the techniques.
And you go around the country teaching these courses, right?
We do. The Norton School is kind of a traveling school in that we don't have a physical location. We're hosted by major hospitals and universities around the country, and sometimes we'll just be in a conference space somewhere in the country where we know it's an underserved area of the country where there aren't any hospitals yet doing the work. So we'll just put a training in that area and start to attract therapists from regional hospitals who then propagate the method.
What is lymphedema, really? Give me a specific definition of it.
Well, lymphedema is usually characterized as a swelling of pretty much any body part. It could occur in the limbs, it could occur in the face, it could occur in the chest wall, or even in the genitals, believe it or not. It's a protein-rich accumulation of lymphatic fluid that stretches the skin and creates a swelling. Here in the United States and more the Western world, the leading cause of lymphedema is cancer therapy. So when you are trying to eradicate cancer, you can't help but damage the lymphatic system. If you don't attend to lymphedema and you just let it continue to march forward and become more chronic, it creates very thickened skin changes that you could characterize almost like a hide of an elephant's leg.
What portions of the body are most likely to be impacted or affected by lymphedema?
Certainly here in the more developed countries where cancer therapy occurs on a very kind of wide basis, it would be the arms and the legs. You can imagine carrying around an arm that's twice the size that it should be. The weight of that on your shoulder can create pain. The fact that you stand out in public because you have a very large swollen hand, people point at you, they ask you what's wrong with you. It's very demoralizing, and the psychosocial aspect of it is another piece that people really need to think about.
I've been specializing in lymphedema treatment and more recently cancer rehabilitation since I went through this very similar course about 12 or 13 years ago. So for me, it was kind of a calling for me. I took the course really just on a suggestion by my employer and then a recommendation by a physician, and then just took to it. Really loved it, loved how much physiology and pathophysiology it takes to really understand what's going on with a patient, and then just the manual work. I really love to work with my hands, and it gives you a lot of time with your patients, so you really get to know them. So it's a really unique niche within my field, which is physical therapy.
Sarah, explain to me what you do in your role as an instructor in this course.
You know, I'm highly involved in teaching the manual skills to the students, so teaching them how to really get a handle on manual lymph drainage, and it's a very unique form of massage, very light touch, and sometimes it really takes doing that over and over again to get the feel of what that is like. So the first part of the course is very didactic, learning a lot of the physiology and pathophysiology, and then the second, well, really throughout the course, we're also teaching their hands, teaching them how to palpate patients and figure out maybe what's going on, as well as how to help them.
What do you think inspires someone to take this course?
Sometimes it's a need, a patient need in a particular geographical area, and their employers are responding to that need and maybe requesting that they get trained. And other times it could be anything from a significant other or family member that has an encounter with lymphedema either through cancer treatment or a hereditary condition of lymphedema. So it can be something personal or professional that brings them in, and that's what makes the course so interesting, is that there are people from all sides of coming into it and different reasons for coming into it.
I love this patient population. This is a really unique opportunity to spend one-on-one time with people and really get to know them. We get to really support them through their whole recovery process. You know, we're involved psychologically with their emotional well-being, their activities of daily living. We're focusing on, you know, with their swelling, we want to make sure that they can remain independent throughout the treatment with their dressing and their hygiene, feeding, writing, driving, things that might become an interference with the treatment. We're there to support the whole process, everything.
At the beginning, I was coming for 3 months straight, four days a week, I believe it was, for about 3 months to get the drainage going, and she would just, you know, just give me the massage that I would need and work on my shoulder blade and my muscles, and, you know, I started to feel better. She was tremendous in just constantly reminding me what I need to do, and because I started feeling better, I wanted to continue. Now I come twice a week. What's the alternative for me? You know, the alternative will be that, you know, I see women walking around with their arms that are tremendous, and I know right away what they're dealing with, and I don't want to go through that, you know. So I do what I have to do. I come here twice a week. I'm in the gym. I'm in the pool. I have to, this is a way of life for me, and it's better than what I thought it could be, even before the cancer. So I try to stay very active that way.
As far as the certification goes, I feel like it changed my career. I mean, I love being an occupational therapist, but this is a niche that changed everything for me. You know, it makes me feel like this is why I got into therapy in the first place, you know, to help this patient population. It's the best thing I ever did.
And there you are, a look at the problems caused by lymphedema. And the treatment for the disease is taught here in the Norton School for Lymphatic Therapy. I'm Doug Llewellyn reporting from Matawan, New Jersey.